Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Scleroderma. So, fine. Scleroderma is a systemic disease which is associated with esophageal abnormalities in around 80% of the cases. In most of the cases, this scleroderma follows a prolonged course. In scleroderma, the patient has involvement of kidneys are seen in some patients, and this involvement of kidneys will indicate poor prognosis in patients with scleroderma. This scleroderma is seen in either third or fourth decade of life, and it is more common in women than in men. So it is more commonly seen in women than in men. And if you see, the ratio of women is to men of scleroderma is around 2 is to 1. It is twice more common in women than in men. That is scleroderma.
thank you and thank you for watching.